Welcome back to the Go training. This is Module 2.1, Introduction to Ebola virus disease in West Africa. There are 3 learning objectives for this module. Number 1, at the end of this module, I'd like you to recall basic facts on Ebola virus disease, or Ebola as we're going to refer to it. Number 2, I'd like you to be able to indicate how the Ebola outbreak in West Africa is different from other outbreaks in the past. And finally, number 3, I'd like you to be able to describe basic measures to prevent the transmission of Ebola. Are you ready? Here we go. Let's start with a little bit of self-reflection. On a piece of paper, can you write down the answers to these 2 questions? First of all, what do you already know about Ebola virus disease? Second, what would you like to know from this module? What would you like to know about Ebola from this module? So just take a few moments, write down a few bullet points to answer these 2 questions before moving on. Are you ready? Here we go. Let me share with you what we already know about Ebola and check that against your list. Experts tell us that Ebola, the Ebola virus disease, originated in animals. Specifically, it originated in a fruit bat. So, fruit bats who were sick with this disease passed it on, infected other animals. Who are these animals? Chimps, gorillas, and other monkeys. So these monkeys are now sick with Ebola virus disease. And somehow they come into contact with humans. So we see a virus coming from animals and infecting humans. They cross the animal-human boundary, the interface. And how do we think this happened? We think this happened through handling of dead animals, maybe handling and consumption of bushmeat. So right at the beginning of this outbreak, people were much more concerned about how bushmeat may be the source of infection. But very quickly, this virus started moving from person to person. So what we call human to human or person to person transmission. What we are seeing in West Africa for Ebola now is the transmission of this virus going from one human being to another. And we can now talk about how this is moving from person to person. So how does it spread from person to person? It's very important that we understand Ebola is spread through direct contact with bodily fluids of someone who is sick, who has symptoms of Ebola. So let's work through this. What are bodily fluids? It can be stools or feces, vomit, blood, urine, saliva, and it can also be in semen or in breast milk of a sick person, right? So it's very important that it is transmitted through bodily fluids, all these things that we mentioned, of a person already sick, showing symptoms of Ebola. Now, we can also very easily get Ebola from physical contact, touching, direct contact with someone who has already died from Ebola. Just think about it. The virus is so robust and the numbers are so high that it has killed somebody, but it continues to survive for some time in the dead body. And when we touch somebody who has died from Ebola, it's very easy to have transmission of Ebola to us. The second way it can be transmitted is if somebody who has been sick with Ebola has contaminated our environment, say the bed sheets, surfaces, equipment used by a sick person. The next thing to know about Ebola is it is not airborne, or measles is airborne. It can be spread, however, through droplets. So if somebody who's sick with Ebola vomits or coughs and there are tiny droplets, yes, that could be a potential source, but it is not airborne. So do you remember that? This is very important to know. Ebola is spread through direct contact with bodily fluids or by contact with a dead person, a person who has died of Ebola, or the contaminated environment that has been contaminated by somebody who's sick with Ebola. It is not airborne. So what are the key facts? What other key facts do you need to know? I'm going to give you some numbers here. The first important number to know is the incubation period. The incubation period is the time from a virus entering our body to the time that we show symptoms. In Ebola, this can be as short as 2 days or as long as 21 days. This number is very, very important, all right? And you will hear about this 21 days later on in other modules. The first number is the incubation period, the period it takes for the infection to start showing in a person is 2 days to 21 days. The second number I want you to know about is something called the case fatality rate. Those of you who are not public health experts may be curious as to this. The case fatality ratio is the ratio of the number of people who've been infected by a particular disease, Ebola in this context, and the number of people who actually die from it. In the past, the case fatality rate has gone from 25%, that it's 1 out of every 4 people infected have died, to 90%, 9 out of 10 people who have been infected have died. Now, this is a big range, but it's important to note that in this outbreak, because of the national and international response and the support we've given to people who are sick, this fatality rate, case fatality ratio, has actually been lowered. It is not 90%, it's somewhere between 50 and 60%. Okay, so we've got a couple of numbers. Incubation period from 2 to 21 days, case fatality rate from 25% to 90%. The third thing you have to know is the specimens that we take from someone who's sick from Ebola to confirm whether they have actually Ebola or not have to be handled very carefully. Remember, we said it's transmitted through bodily fluids. So these bodily fluids, like blood that we take to confirm laboratory confirmation of Ebola, needs to be handled very carefully, and you need a very sophisticated lab. It's called a BSL-4 lab, a biosecurity level 4 lab, in order to handle these specimens. All right, so this is another fact to know. Another fact to know is once you've got the specimens in a suitably safe environment, that there are diagnostic tests, blood sample, swabs that you can take from a person, swabs you can take from dead bodies, that we can use to now quite rapidly diagnose. So the only way to diagnose Ebola is through a diagnostic test. The last thing in this particular slide I want you to know about is that, luckily, and fortunately, because we're giving treatment earlier and earlier, supportive treatment, people are recovering. But there are studies that show men who have recovered from Ebola can continue to spread the virus to their partners. So we see, not in other bodily fluids, but in reproductive fluids, we can continue to see the virus being shed. All right? So this is a point of caution. So now you know 5 very important things about Ebola. The incubation period, the case fatality ratio, how specimens have to be handled, that there are diagnostic tests, and that even after you recover, men could be shedding the virus. This is already a great deal. All right, let's move on. So, I want you, if you can, jot down the few things that we've learned so far. About how it spreads. Ebola spreads through direct contact with bodily fluids of someone who is sick, of someone who has died of Ebola, or the environment, the physical environment that has been contaminated, and it is absolutely not spread through air. All right, next, signs and symptoms. So how do you or experts know when somebody has Ebola? Well, the first clue is sudden onset of fever, accompanied by weakness, muscle pain, a terrible headache, and sometimes sore throat. So now, for those of you who've worked in Africa, you'll say, but this is very similar to other diseases. So let's continue. If you have Ebola, you have all of these, the fever and the associated symptoms, and very quickly it'll be followed by vomiting, diarrhea, sometimes a rash, and experts will be able to know there are signs of kidney and liver dysfunction. In some cases, not all, there will be internal and external bleeding. Now, these 2 points will tell you why Ebola is called viral hemorrhagic fever. It's caused by the Ebola virus. It's called viral. Hemorrhagic because in some instances there's internal and external bleeding. And fever because there's usually always fever. All right. Now, patients become contagious once they show symptoms. And EVD infections can only be confirmed through laboratory testing. Right? So you need to know the signs and symptoms, and you need to know this must be confirmed through laboratory testing. Now, again, as I said before, if you understand public health or you've worked in Africa, you know there are many other diseases that can be similar. Malaria, typhoid, Shigella, cholera, leptospirosis, relapsing fever, meningitis. There are and other viral hemorrhagic fevers. So the laboratory diagnosis is very, very important. So, what do you know about symptoms? You know there's fever. You know it's accompanied by muscle ache, headache, sore throat, and sometimes rash. And it's accompanied by diarrhea, vomiting, sometimes bleeding. Is that right? Anything else you can remember? Write down anything else you can remember. Remember, the clues are in the name. Ebola is a viral hemorrhagic fever. So sometimes you get bleeding, and definitely you will get fever. Are you ready to move on? So, what happens when someone has Ebola? It's very important to be very honest at the beginning and to admit to ourselves and to communities there is currently no cure for Ebola, as there are no cures for many viral diseases. But we know the sooner someone with Ebola comes for supportive treatment. And what is supportive treatment? Rehydration and intensive care, the greater the chances of survival. And this is why, as part of Ebola response, you will see many governments, the governments that are affected, but also many other foreign medical teams and WHO and other organizations have set up Ebola treatment units and Ebola care units to provide this supportive treatment which actually increases survival rate significantly. Now, are there some potential treatments? Yes, several are actually under research. Monoclonal antibody treatment. There are many treatments. But currently there's very limited availability. There's limited information on their safety and effectiveness or efficacy. And some candidate drugs, some of these potential medicines, are in the early stages of testing. Also, there are vaccines in development. But currently, prevention and supportive care are the mainstays of our response. So, let's look at this from a bigger point of view. We've talked about the virus, we've talked about the disease. So, it's very important to see how this has evolved in West Africa and why it is such a challenge. In the red on this graph, you will see the number of cases reported initially. We're talking about the first few months here, in Guinea, in red. Now, it's important to know what we think is the index case or the first case we think started in a corner of Guinea that was close to Liberia and Sierra Leone. And the social context here was that people were moving between the three countries quite freely. And this makes this outbreak very unique and different from previous outbreaks. Previously, it was never in West Africa. It was in other parts of Africa. And often previous outbreaks were in remote villages which we could cordon off and provide support, but we could prevent it going to other places. But in today's world, where people are moving about, where some of this is happening in cities, where people are very mobile, it's very difficult to contain this. And you can see very quickly, everybody thought numbers were beginning to go down, but very quickly it spread to the other two neighboring countries. So the three countries predominantly affected by this Ebola outbreak have been Guinea, Liberia, and Sierra Leone. And this map shows in the situation in August of 2014, how the disease was moving around. There's a lot more information on WHO website, on SITREPS to show you how this evolved. So, Ebola outbreak in West Africa was the first large Ebola outbreak in this sub-region. It had serious impacts, not just only on the 3 countries, but it was seen as a potential global health security threat everywhere in the world. And it really highlighted the situation in these countries where they had extreme weakness in their health systems. There was not enough preparedness. Surveillance, healthcare, communications were all very limited. Health workers were limited, and very quickly we saw health workers become infected, and there was inadequate infection control and prevention. So this outbreak came in a country that was really not ready for this. And of course, there was very quickly, as I said, cross-border spread. Ebola happened in villages that actually crossed national boundaries. Parts of the villages were in one country where the rest of the village was in other countries, and relatives lived in all 3 countries. And we mustn't forget the effect of fear, denial, that people really were very frightened of this, and that actually prevented effective response throughout the last few months. So, what can we know? We know how it's caused by a virus. We know it's spread by direct contact of body fluids of someone who is sick, someone who has died, or the contaminated environment of where someone who was sick lived. All right? We know what was unique now about this and what we call an unprecedented outbreak of Ebola in West Africa. Now, the next thing to know is how to prevent. And the good news really starts here. The good news is we can prevent transmission with common household items that you have in your home right now. The most basic prevention method is soap and water. Soap and water kill the virus. And if we know how to wash our hands properly with soap and water, we can prevent transmission. And you can protect yourself and everybody that is around you in West Africa. If the environment is contaminated, we know how to eliminate the virus. We know that we can beat it with alcohol-based products and many commonly used disinfectants like bleach. So this is really the good news. So, let's be clear. Ebola does not spread easily in the environment. It's not airborne. It's generally not passed through casual contact. The risk of infection is very small, minimal, if you don't have direct contact with sick people. Now that's why if you are going in, you're being deployed for clinical care of sick people, you will be given additional training on how to protect yourself, including the putting on and the safe taking off of the full personal protection equipment. So, the white suits that you see on the news all the time. So unless you're handling sick people or people who have died from Ebola, that is not something you're going to need. If that's what you're going to do, you're going to get specialized training on the ground. Also, individuals become contagious. That means they can pass the virus from one person to another only when the symptoms appear. Now, these facts should give you confidence about how you can prevent and confidence about how you can operate safely in West Africa in Ebola response. So, here is a full reminder. The signs and symptoms: fever, vomiting, diarrhea, rash, headache, okay? But only really confirmed by laboratory diagnosis. We know how to prevent with soap and water and use of common chemicals, right? You will learn later in this training and maybe when you're on the ground how to wash your hands properly so that you know how to use these common ingredients, soap, water, bleach, properly. How it spreads: through direct contact with body fluids of someone who has symptoms or someone who has passed away, or direct contact with a contaminated surface or environment. You know that it's not airborne, and you know that people can survive Ebola. As much as 4 or 5 out of 10 people with Ebola are surviving it. So go to these posters. This will be part of the additional material you get. Use it to make your work easier and use it to communicate with other people who may not know these facts. So let's recap. What do you remember? What causes Ebola virus disease? I've given you the answer in the question. Number 2, how does Ebola spread? You should know that by now. Number 3, what are the signs and symptoms of Ebola? And number 4, very important, how to prevent the spread of Ebola. Now, these 4 things, these 4 topics should give you basic knowledge, should give you confidence, should help protect you and those around you, and should make you an advocate and a good communicator for your teams so you can relieve any anxiety your team members have, and also you can be an advocate of how to prevent Ebola. I hope you found this module useful. I will see you in the next module.